Honorable professors, dear guests, experts, ladies and gentlemen, thank you for your invitation, and I have learned a lot from the previous speakers. So my topic is a little bit different from the previous speakers. It's about the future of diagnosis and treatment of obstetrics and gynecology diseases of minimally invasive technology. So, I'm a multidisciplinary person. I've involved in different disciplines. So, endoscope, artificial intelligence, all my areas. So, the GIC, endoscope, HIFU technologies. So, for decades of promotion and publicity of our HIFU technology. So, the first HIFU equipment is done by, the first one is done by us in 1999. So recently, when I visited the HIFU company, I saw the very rapid development and progress of this technology. And all these data and information are given by HIFU, and it has been used around the world in many different diseases, including uterine myoma is a very typical case with very good results, and some evidence-based medicine research, and which have been echoed by many of the speakers. And there are many other papers on this subject which offer us some objective evidence or guideline for us for the treatment of uterine fibroids. So this is an intervention treatment of adenomyosis through MRI observation, and through this dynamic observation we can see its good effects with different sorts of the disease. We know the different size, different types of adenomyosis. Especially for diffuse type of adenomyosis, is very difficult in treatment. And the morbidity of this disease is not low. So I have came across 3 cases of adenomyosis without any sexual life in his life of primary adenomyosis. So as the surgeon or interventional surgeon and physician, we feel difficult. We have no other solution but to cut the uterine of this lady. So for the diffuse adenomyosis, HIFU technology is very important and effective. And these are the evidence and papers of evidence-based medicine, and different times terms of follow-up data and information. So 3 symptoms. One is a pain or dysmenorrhea or menorrhagia. And HIFU technology can solve the problems of dysmenorrhea or menorrhagia. About 82.3% is the rate, so fairly high of the relief rate.
那是准备叫我多讲点是吧？那就不停的给我争取时间。好，谢谢。这个把它全屏好吗？谢谢。
Okay, let me put this into full screen.
我这地方需要全屏。这是关于囊肿研实也是我的师傅他就是。
So my teacher, Professor Lang Jinghe, published a paper on the treatment of adenomyosis with multi-model treatment. So it is a type of what we call chronic cancer for the women. So the General Hospital of PLA. So among the 236 patients with adenomyosis, and 216 of them completed follow-up with a median follow-up time of 40 months. And the symptom relief rate is 82.4%, and the recurrence in 49 patients and 25 patients underwent re-intervention cases. So there is no 100% relief rate unless you cut this uterine, you remove the uterine. And in this case, we can see that the uterine shrinkage rate was 43.9%. And we know that it's difficult for the adenomyosis patient to have the uterine shrinkage. So as you may see from this paper, according to the quality of life score, and increased by 80%, and there were 6 successful pregnancies and 4 deliveries, and symptoms recurred in 14 patients. So in terms of the clinical benefit, it can eliminate periodical pain, which is painful, and ablation of thickened lesions in the myometrium, and reduce the focus area of endometriosis and loss of ectopic endometrial function, and improve the environment of uterine conception and promote fertility, so that the local treatment of diversified treatment. HIFU technology can also be used for many other diseases like placenta acrita, or scar pregnancy, or abdominal endometriosis. And yesterday we were also talking about the application of vascular interventional techniques. For example, Professor Huang mentioned about lymph treatment by HIFU technology. So lymph metastasis by using HIFU technology. And with HIFU technology, with the investment of the capital, then it can be applied and used. And this is what I did since 1996. And this is the observation data of the shrinkage rate curve of uterine myoma after artery embolization. So myoma volume, as you may see the data. And this is the process, pathological changes of uterine fibroids after artery embolization. So this is a very interesting process, 19 days after the operation and 10 months after the operation, 2 years like eggshell, and 3 years. So the indications of the interventional treatment of uterine myoma As you may see here, we have 1, 2, 3, 4, 5 points. So uterine myomas interventional treatment. Patients with uterine fibroid with non-vascular rich fibroids and with uterine myoma who have fertility requirements. So are clearly suggested go without this treatment to preserve the fertility. And there are some other contraindication of interventional treatment of uterine myoma. For example, patients with strong fertility requirements or patients with pedicled subserosal fibroids and broad ligament fibroids. And as you may see from the slides, the UAE effects of total menorrhagia 5 years after surgery. And the recurrence rate is 33%. But its effect for the menorrhagia is good, and also the change of uterine volume after UAE operation in adenomyosis with good absorption rate. And this is before and after the treatment UAE for adenomyosis and some other vascular interventional technique for cervical cancer and ovarian cancer and some other diseases like placental implantation, ectopic pregnancy, and various obstetric hemorrhage. So this is the issue that we are interested in for the obstetrics and the gynecologists. And HIFU technology in terms of irreplaceability is uncomparable. So I'm involved in HIFU technology. So interventional treatment do harm to the doctor, but no harm from HIFU technology to the doctor. So interventional treatment is not suggested. In the future, the application of artificial intelligence in obstetrics and gynecological diseases. For example, the patient with uterine myoma, and what might be the solution? So first of all, we have the evaluation by 3D remodeling, so that we can have all these indicators remodeled with CT and MRI, and to construct the blood flow system and have this evaluation in different types, whether it is extremely rich or general or non-rich. Because different types of blood flow has different impacts on the solutions of the methods adopted by the doctor. So after the evaluation, then we're going to have this treatment. So which solution might be the best for the patients? Based on the objective situation. So the doctors should know the benefits and shortcomings of different treatment or methods and try to select the most suitable one for the patients through the evaluation by optimizing the selection of the methodologies and treatment portfolio. So we can use the digital navigation to have a general mapping of the operation in details, and then input these data into the computer and have the 3D remodel with this program from the computer. We use the interventional robot, and the doctors only need to monitor the surgical procedures and make the corrections. So high-flow technology will be better for those ones with lack of blood flow type. Through this remote system and diagnosis and solution will be offered to the patients. And for those who are not willing to receive high-flow technology or high-flow operation, so we are going to remodel in its anatomy model and to check the organs of the body and the location of the myoma and mark the location and make the personalized or tailor-made strategies for these patients. So we have done this for over 10 years, as you may see from the slide. So we have the real-time digital navigation during the operation, and also the clinical application value of digital three-dimensional reconstruction of artery network of uterine myoma. The artificial intelligence neural network, by computing the data to see the efficacy and effectiveness of different solutions through this software, through this program, to do the computing and to calculate its recurrence rate and recovery rate and so on. And this is our prospect. And we have done these work for quite a long time, and hopefully we're going to learn from each other and communicate with each other more. So what is this flower? Do you know what is this flower on this slide? So it is blue in the night. What is it? It is a flower of a pitaya. So that's something that you don't know, right? So that's echoed with Professor Lang Jinghe's words. There's a lot of things that we do not know, and a lot of things that we don't understand. We must keep on learning.